Hello. In chapter 10, we're talking about group counseling for the treatment of addictions. Group counseling plays a vital role in the treatment of addictions. In the limbic region of your brain, there's four areas that are damaged in your substance or addiction, in your addictions. Your abstract and moral thinking is damaged. That's why the curriculum that some group therapists utilizes for psychoeducation and other types of clinical intervention help to re-strengthen that area. Your self-monitoring is damaged. So that's why drug screens and checking for to make sure the client is remaining abstinent is very important. And the social aspect, right? Your social thinking is damaged. And the group counseling and groups actually help to re-strengthen that part of your brain. So in this PowerPoint or this lecture, we're going to discuss group counseling and the treatment of addictions. So group counseling, it offers a number of advantages for individuals or other counseling methods, including creating a sense of universality or understanding that clients are not alone in their struggles. There's empathy and support provided in the group, right? And it creates the necessary atmosphere for the counseling process. It includes the collective mindset to gain perspective. Again, but it cannot be for everyone. Some people don't do well in big settings or with other peoples or whatnot. It can be too overwhelming for some clients or whatnot. And it cannot create an environment that gives them the freedom to express themselves. For a group of individuals that have similar experiences, it's helpful at times to break down the denial frequently associated with addiction because other people are experiencing that level of denial, right? Individuals who participate in long-term substance usually typically exhibit poor communication skills and an ability to perpetuate healthy personal relationships. So group counseling affords that opportunity to grow those skills. Psychoeducation groups are an increasingly popular and make an important source of help for many clients, right? It's one of the greatest aspects in group therapy and whatnot because it's educating clients on areas of addictions and whatnot that they suffer from and how those things benefit them physiologically, socially, and in their environments. In structured psychoeducation groups, it is not unusual for the agenda to be established before the group session. They're generally limited to modifying goals, agendas, and contracts the counselor has already developed. Interventions are planned and focused on specific learning outcomes. Integrated behavioral therapies and experiential learning is a common practice. Group can aim to help members translate what they learn into specific action. And also with psychoeducation group, before we move on to psychotherapeutic group, it's really important to understand that the treatment plan should be so individualized that each topic of psychoeducation is provided should actually play a role in the client's treatment plan as part of their education and part of their therapeutic process. So when we move into psychotherapeutic groups, these are commonly utilized in addiction treatment as well. They explore foundations of current behaviors, seeking to build an insight and replace dysfunctional coping patterns. They can learn how to offer feedback to each other. They can provide behavioral models for each other. And it's useful for clients who don't necessarily trust counselors or have that stigma about counseling itself, right? Each individual might also find other members who provide a reflection of his or her family of origin, allowing the individual to work through problems from the earliest stages of growth. They typically do not have specific agendas for each session. The group counselor may choose to offer specific topics or areas for a session, encouraging the participants to explore more pertinent life issues. They're particularly helpful for clients that are dually diagnosed or have comorbid disorders. Again, mental health and substance abuse disorders that are influence each other. And there's limited evidence that group psychotherapy approaches are effective to treat substance abuse disorders. However, the treatment approaches that incorporate a large proportion of group counseling to individual counseling and possibly associated with increased likelihood of treatment success. So, self-help groups. So instead of seeking out help from mental health professionals, some clients may seek out for self-help groups or mutual help groups. These are voluntary groups and they have members that share common problems and meet for the purpose of exchanging social support. So most are self-governing, with the members rather than experts or mental health professionals determining the activities. These groups stress the importance of reciprocal helping, because the members are expected to be both give help to others and receive help from others. AA is an example. Alcohol Anonymous is an example of a self-help group. So when we talk about groups, the leadership is always important. So the competence of the leader is always really important. Addiction groups may be facilitated by leaders who may vary from formal training and personal experience with the recovery model. Professional counselors who lead groups are called to practice within the scope of competence. So group counselors who would do well to consult with the association of specialists in group work, professional standards for the training of group workers, for further clarification regarding the leader's competence. Ethical group leaders do more than meet minimum requirements for training and experience. So screening participants for your group is really important because it's really important to make sure that, again, a lot of times that your clients are at an appropriate level of care and receiving appropriate interventions for that level of care, right? So the ACA Code of Ethics specifically calls on counselors to screen members for compatibility with group goals and memberships. Not all clients who are in need of in group counselor are actually a good fit for the modality, right? So it's really important to screen out those who can be helpful with it and those who cannot be helped with it. Informed consent, just like we talked about with any other classes or any other populations, we have to get informed consent and communicate the client's basic rights to each other and responsibilities for prospective group members. Ethically, group counselors inform prospective clients of their nature of the group process, benefits and limitations to such counseling, education, training, and credentials of the group counselor, expectations of the client with the group, within the group, and the right to terminate the counseling relationship. Confidentiality. Again, with the stigma of SUD treatment, substance use disorders treatment, the federal government enacted a law commonly referred to as CFR 42, Part 2, that defines the limit of confidentiality for SUD programs in the United States. Because of 42 CFR Part 2, a client mere presence in a chemical dependence facility is considered a diagnosis and cannot be revealed without written consent. Counselors can never guarantee full confidentiality in group work. Counselors can guarantee confidentiality themselves within legal limits, but cannot control what other group members do. Many group counselors find that that involving the group in the process of establishing rules related to confidentiality is the most ethically responsible approach. Oftentimes, I tell my clinicians to make sure that they're monitoring, make sure no one's phones are out in group, and we talk about it and reiterate this and go over those rules and expectations of almost every group, so clients can feel comfortable that their privacy is not being violated. So voluntary and involuntary participation. So specific counseling and ethical concerns arise when faced with involuntary group participants. The counselor must work diligently to engage and encourage involuntary members to cooperate to avoid undermining the efficacy of the treatment. So conflicts within the group. So when group members give feedback or receive feedback, they can lead to definitely some emotional reactions. When conducting group counseling, it is important for the counselor to consider the implications for the resistance and conflict. Again, from that motivational and interviewing standpoint, that ambivalence to treatment, right, on a macro or micro level, right? So again, that group resistance can lead to arguments, can lead to interrupting, can lead to ignoring, can lead to shutting down, right? So groups are best addressed from a cultural perspective when three distinct dimensions are considered: issues of age, culture, ethnicity, gender, sexual orientation, and social class. Concepts such as educational background, geographic region, relationship status, and spiritual belief systems account for the historical era and context of the current societal climate. Ethnicity. People of all ethnic background experience the ravages and addiction regardless of cultural approval or disapproval of the use of the substance. African American and Hispanic clients are 3 times as likely to seek treatment for substance use disorders than Caucasian clients. Group counseling across cultural is affected by societal biases and norms and challenging to leader regardless of the leader's ethnicity. Group counseling facilitates a balance of power or status of among members. Races carry inherent status cues that can alter the balance initially. And gender can play a role. The process of group counseling is more stereotypically feminine method of dealing with interpersonal issues. It has a heavy reliance on talking through conflict and providing verbal supportive feedback. Men can often respond better to male-only groups where all are participate in what might be considered a feminine activity. So leading man's group should be sensitive and do work around shame, guilt, abandonment, grief, fear, dependency, and anger, but not be afraid of any of these emotional states. Um, Often emotions need to be addressed. Counselors must be aware of their own fears about challenging men, resulting from some of the gender stereotyping that challenges the group members. Working with women requires the counselor to facilitate interactions that encourages insight leading to behavioral change. All female groups are more likely to focus on feelings related to the effects of the addiction has had on parenting and on the guilt and shame they may present as a result of that of their parenting experiences. And while there's strong research on the efficacy of the all-female group, some results indicate that mixed gender experience may be even more powerful for women clients. Some evidence suggests that the mixed experience allows women to the opportunity to participate in healthy relationships with men and in a safe and controlled environment. Sexuality plays a role. When group counselors will face the challenge of negotiating sexual identity stereotypes within group environments, much like the gender stereotypes discussed previously. More than other minority groups, integrating sexual minorities into a largely heterosexual experience requires sensitivity and planning on the part of the group counselor to provide member safety. Group counselors working in addictions find that differences in how members perceive the various types of substance use may create distance between members. The NA acknowledges alcohol is a drug. AA does not. The mindset of alcohol is legal, and at least I'm not a crackhead creates a challenge in groups to manage the diversity. Because the spouses and children of addicts experience their own personal problems arising from addiction, it's not difficult to understand they need treatment opportunities to offer themselves to family members. And understanding how family plays a role in addiction, how an addiction can challenge the family, right? And also giving them different ways of coping the system with modified stereotypes, repetitive and maladaptive behaviors and responses to their family members' behavior. So you also want to address outbursts directly, quickly to promote members feeling safe. Encourage members to maintain a normal tone and voice and avoid loud voices or yelling. Create contracts with members to address behaviors that require practice. If group members demonstrate emotions that seem likely to be resentment related to giving up alcohol or drugs, address the issues openly to facilitate opportunities to discuss their anger. Ask members to repeat back what they hear to others members when tension creates interference with hearing one another. Facilitators must pay attention to promptly take a part of subgroups. Deal with members who monopolize group time in straightforward and open manner. Allow opportunity to shift between emotion and thoughts can be calming and allow room for growth.